We're excited to introduce Sciton's original series, LaserChat, where laser experts share their tactics and techniques, proving that there is more than one way to treat every condition and certainly every patient. Today's experts, Taranto and Erin Hennessey, share their insights into the world of lasers.
So let's get started. We're going to start with my first case. You're going to see the photo, and you'll get to dive into what you would do for her. Just a little bit of background on my first case. So she's in her 50s, and she's had treatments before, but it's things like hydrofacials, chemical pills. She had never really dived into any type of laser procedure. And her husband was at an event at a live auction and bought a treatment package for her. And so what we did was the start of the treatment package. So I'll let you kind of take over and see, take a look at her and see what you would do for her.
Sounds great. So this patient is very much like the patients that we see in my office as well. Maybe they've never done anything invasive, but they would really like to make a good difference in their skin. And so for her, seeing that she has some pigment here in the US, we see a lot of that on the left side because of driving. She definitely, we could go a couple different ways with her. I love going right to halo with these types of patients because you can give them that wow factor and really make them glow. If she was apprehensive about jumping right into a laser procedure, you could always start small with maybe chemical peels, but really for that wow factor, I don't think you can go wrong with halo with this patient. I would probably start her out, especially with the deep wrinkles, somewhere between 450 and 525 at about 30%, and then set the 2940 at 30% as well, just to give her some exfoliating, just to get that top dead layer of skin off. I do see quite a bit of pigment, but if she got some improvement in those fine lines and wrinkles, I know she'd be really pleased as well.
Exactly. So you're very close to what I did. I actually combined BBL with halo. She is a golfer, and so she had a lot of pigmentation as well. It was the end of the summer, so she'd been out of the sun long enough that I felt good about adding BBL prior to the halo treatment. One of the things, because I'm so critical of photos, that I'm going to criticize my own photo right now, is that she has a little bit of expression going on in the before photo. And so even though her lines look so much better in the after, I think that kind of plays to that a little bit. But what I will say is, you do notice it face to face. She came in and said, wow, I really noticed improvement even in my fine lines and wrinkles. And you would have thought we did Botox, but we didn't, because she had gotten this one item in this auction. I thought, well, I've got one chance to do a really thorough treatment. And so I did a combination of BBL and halo. And so instead of looking at the BBL treatment and doing multiple passes and then spot treating, because there's a number of different ways that you can attack that in terms of when you apply the numbing. Do you do numbing first and then BBL halo, or do you do the BBL first and then numb and then do halo? Typically in our clinic, we don't numb the skin before BBL, and so for our new providers, I have them do the BBL portion first, then numb the skin, and then do halo. But in this instance, I've done so many BBLs and halos that I just numbed her skin prior to the treatment. I did a thorough pass with the 515 filter, so not multiple passes, just one good quick pass. 515 at 10 or 11 joules, 15 milliseconds, and 22 degrees cooling. And then I always kind of look back to see if there's any little spots that could respond better. So could I get more erythema? Could I see more microcrusting in spots that she had pointed out to me? And in that instance, I would go back and treat with the 7mm spot at 15, 15, 15, it's something like that. Sure. But with her, I dove right into the halo treatment. And so I did a 400 micron treatment at 30%, because I found that 30% coverage at the 400 micron depth gets the skin to peel.
It's that sweet spot.
It really is. So if you do 20 or 25%, sometimes you don't see that full peel. And if you under measure, then that also affects that full surface effect that you get, or full surface peel that you get. So I did the 400 microns at 30% density, and then just 20, and I maxed out that up to 30%. And then I went back and I remeasured around her mouth. She had a lot of fine lines she doesn't like around her mouth. And I did an additional treatment of 500 microns and an additional 20%. And then I dialed erbium to 100 microns and took it to max based on, and that's always governed by what the 1470 setting is. And so you can see in the photo, she's still pretty red around her mouth. The photo was not even maybe a month out, and so she may still have some residual swelling or edema, but she definitely still has some redness around her mouth. But I told her to expect it, and she was fine with it. She knew that, this is my treatment. I would really like to get the best result that I can, and from a safety perspective, I felt comfortable doing that full treatment and then coming back and readdressing just the perioral area so that she could see some nice texture improvements around the mouth. And she was thrilled.
And we always talk about erythema as well. And we always say that it means that there's collagen building. So we don't mind erythema, but I find a lot of times if you're educating them ahead of time, you're giving them a warning, you're giving them education. If you're telling them on the flip side when they're concerned about it, they feel like you're making excuses. Exactly. So we do a lot of education just as you do prior so that they know what to expect.
Great, wonderful. Let's jump to one of yours.
So this next patient that I had, she's a wonderful, wonderful lady. She came in for rosacea mainly. She was unhappy with her flushing. She's a Fitzpatrick type 3. So we, made sure that she was using good sunscreen because she was a bit of an outdoor girl. And so we waited that month for her skin to kind of calm down and that tan to fade. We went ahead and did our BBL protocol because obviously for rosacea, we get such great results with it. But we kind of also wanted to treat some of her brown spots as well. It wasn't something that was concerning to her, but we knew we could make a good difference in her skin, and she was very, very excited about that. So we got all of that to calm down. For our rosacea treatment for this patient, we started her out in her very first treatment a little bit lower to get to know her skin. So we used the 560 filter, fluence of 9, pulse width of 15, and we cooled it to about 22 degrees because we didn't want it to be too cool. We still wanted to get that good end clinical point, but we also wanted her to be comfortable through the treatment.
Sure.
Occasionally we'll pull out the Zimmer chiller and let them just kind of go back and forth with it just for a little bit of control and comfort. But for her, she tolerated it very well. And then from there, we went on and once you start doing some of these things and your skin starts looking better, she's like, I would really like to do something more. And so I'll let you kind of, if she came in for you for more after her rosacea treatment, what do you think you would go with?
Okay, so taking a quick look at our photo. So since this is a discussion of, just how I would approach it overall, I might flip it a little bit on you.
Okay.
Okay, so if she came in and I could do anything that I wanted for her, and there were no boundaries, no budget restriction, anything like that, looking at her skin, if her number one concern is rosacea, if that were her only concern, then I would just jump into BBL treatments. Do the series of 3 to 5 treatments based on how her skin responds, because to your point, be a 3, maybe on the verge of 4 after summer, being conservative with rosacea. And honestly, with rosacea, I used to, when I got started with IPL technology years ago and then into BBL, it was really common to use a lot of high energy pulses on the skin for the rosacea. And now I've gotten to a point where instead of just doing 1 or 2 passes of that Forever Young BBL protocol where you're doing lower energy with a lot of cooling in the skin and then you jump into those higher settings, a lot of times I'll do 3 to 4 to 5 passes and then jump in and spot treat the areas that aren't responding, because to your point, it keeps them a lot more comfortable. They're more likely to come back and you still get a really beautiful result with the rosacea. So I see in her skin something more than rosacea. It's kind of like she's lacking the glow. Her skin looks dull. She's got some pigment. So there's an overall kind of multiple factors that are going on in her skin. So if I could take a look at her skin and choose a program based on what I would like to do, I actually would start with Halo. And I would do a 400 micron depth at 15 to 20% density. For her, and you're telling me she's a 3. She looks a little bit like a 4 in that photo, just because. So it's a little deceiving. So if she's truly a 3, I would do 20%, and then just do a 20 micron 19, or a lot of people say 420, 2020, but the software doesn't actually go up to 20, so it's really 420, 2019, which is not an aggressive treatment. It's a very common treatment, but you get a nice kind of surface peel. And then I would follow post-Halo with a series of BBLs to shut down the rosacea, shut down the redness that comes up from the Halo treatment, so that she gets that glow from the Halo treatment. And then knowing that rosacea flares a lot of times post-Halo for 3 to 4 weeks, I would have her come in at that 3 to 4 week mark and start that BBL process or that BBL program post-halo. So then at the end of the treatment, she's got that glow, and then you're treating her rosacea, and then any pigmental lesions that I've missed with that halo treatment, I could then grab with the BBL treatment. So just another way to do it.
Well, and I love that way of doing it because you get that wow factor right away. For her, I think she was a little apprehensive because she'd never done anything before. So I'm always apprehensive to start right out with halo for someone who, I'm like, so tell me how you take care of your skin. And they're like, I wash it every day.
Yeah.
And you're
With
like,
dial soap.
Okay, so let's start from there. But a lot of times with rosacea, what I found as well is I love those settings, and I use them quite frequently for melasma as well. The 400-20-20 has been a really nice setting, or even 15-20, depending on their skin type. With the lighter skin types, we can usually go up to 20. With the darker skin types, more 15. But with her, she really kind of had that readiness to her skin, and I was scared to jump right into something more aggressive with her. So it was a good stepwise process. But when she came in for her halo, because of course after BBL everything's looking great,
right.
You want to really kind of clear the skin and make it look bright for her. She had gotten a phone call and had to leave very quickly. So our halo appointments are usually 2 hours, an hour for numbing,
right.
And then for treatment time. And she said, I have 15 minutes. And she was incredibly disappointed. You never want your patients to leave unhappy or disappointed. So I said, if you can give me 15 minutes, we can at least get you started. And I, instead of my halo head, I put on my fractional head. We turned on the Zimmer chiller. We put that on. We let her have control of that Zimmer chiller. I set the fractional to the lowest level it could, which is 25 microns at 11%. And we went over very comfortably over her whole skin, and she was glowing the next day. She was wearing makeup the next day. She really only had just a bit of erythema, but she was glowing. So for that event that she had, she got a great result, and she looked wonderful.
It's beautiful.
And then we're looking at halo for the future. So every so often, patients' lives change, things happen, maybe, appointments get changed, but they want to leave having had something, and they want to leave with their skin improved. So it's great that we have all of these tools in one system that we can reach for. I'm like, if you can give me 10 minutes.
So did you just adjust the pricing of her treatment that day, and then
we did?
So,
We did. So we just adjusted it to the fractional treatment, which was a little bit more reasonably priced, and price was a factor for her. So halo was a bit of a splurge, and as it is, I think we all want to use our aesthetic dollars wisely. But she really, was disappointed. You never want your patient leaving feeling that way.
Yeah.
So I said, you know what? Why don't we do this?
What a beautiful outcome at just 25 microns of fractional. That's awesome.
I think we think about our more aggressive treatments and the results that we get, but we can get really good results with very little downtime with some of our more superficial treatments as well.
Sure, that's awesome. Okay, so we're gonna jump into one of mine. All right, so it's a Fitzpatrick 4 patient, and she has active acne. And when she came in, of course the active acne has been something that she's struggled with for many years, and I hate that for our patients, for men and for women. It's just so wearing on them as individuals. And she tried many things and nothing seemed to be working. And she's younger. She doesn't have a huge budget to spend. And so number 1 was active acne, and then number 2 was just the acne scarring that now, having had it for multiple years, now she's got the scarring. So it's like she can't get either improved. And so what would you do in this scenario?
Coming from a background of having had acne, I have a little bit of a different, kind of unique approach that I, kind of ask them first about more the psychological end of things. How does this affect your everyday life? Do you feel that there are social situations that you avoid? Just to kind of get what the impact is on their life. I have some patients that are actively avoiding going places, going out, which is incredibly sad. And then on the other spectrum, I have some teenage boys who could care less about their acne, and it bothers their mother more. So I try to see what that acne means to them first. But for her, really, the Forever Clear BBL, I feel like is a home run for these patients. She definitely has some significant scarring, the erythema, and as we go along and we move through those Forever Clear protocols in our practice, we like to also integrate chemical peels or dermal infusion, because occasionally, not all the time, but occasionally you have someone who isn't exfoliating properly, and I find that when they're exfoliated properly, that Forever Clear BBL, for me in my experience, works a little bit better. Even dermaplaning and getting some of that top layer of vellus hair off before you treat them really makes a difference. So for me, I would say probably about 8 treatments of the Forever Clear BBL combined either with dermal infusion or with a chemical peel, somewhere in the middle usually, and possibly even on the tail end would be what I would say. Based on her hormonal pattern, I may even integrate some spironolactone afterwards for maintenance. But I mean, in this picture, you changed her life.
Yeah, she just, I mean, she had such an incredible result. And, you know, these are the people, it's just like you want to help, you want to do whatever you can to help them, because just to your point, you know, women that I've had a client before that she had never been on a date and she was 30 years old just because, you know, she had active acne, and every time she'd get ready to go out, she'd break out and then she would cancel the date. And so she was early on in my career, and so ever since her, the same thing with me, it's like you just really want to dive in to get to know, you know, what's going to be the best approach based on how it's affecting them.
Sure,
and so similar to what you suggested, so we did start with the Forever Clear protocol. So we used the 420 filter, the 560 filter, and the 590 ST. And so starting with the 420 filter to really address the bacteria or target the porphyrins in the skin, the 560 filter at 11, 20, 15. And actually we did a two-way protocol with her where, you know, initially when the Forever Clear protocol came out, it was still using the longer pulse width. And so, you know, the first step of the 560 is doing 6 joules at 180 to 200 milliseconds, depending on the software that you have with Sciton or the BBL. And, you know, 15 degrees cooling, which is a really long pulse width. It's delivering that amount of energy over a long period of time. And then we started integrating a pulse or a treatment specifically for the redness associated with the breakout. And so going, instead of from using that long pulse width, shrinking that pulse width back down to what you would use to target any type of vascular lesion. And so using, you know, 8 to 9 joules at 15 to 20 milliseconds and 15 to 20 degrees cooling, and just spot treating the active breakout, because then they get immediate or almost instant gratification tomorrow. You know, it starts to look better tomorrow, which has been so important in that Forever Clear program. And then following with the 590 filter, and, you know, really just heating up each zone. Our protocol is just to heat it up 3 times. They give you an ouch 3 times. You don't want it to be painful. I'm very clear with them, but you start the program and it's like, okay, tell me as the heat increases, and I don't want it to be painful, but I want you to let me get it hot. And so I would treat one side, the other side, come back and kind of go back and forth 3 times in each zone. And prior to doing the BBL treatments, we did steam, extractions, LED lights. So, you know, there's a number of other treatments that I incorporated into her program based on, number one, she's younger. You know, let's start with treatments that really help to calm it, so that at home she also starts to use her skincare program or products. Because that's what I found a lot of times, especially with teenagers, is that, you know, they don't do their at-home care. And so if you can give them some immediate gratification within a treatment or 2, they'll start to use their products.
They will.
And then they get even better results.
Absolutely.
And so the first few months with her was 3 Forever Clear treatments, steam, extraction, LED treatments. And then you'll see it kind of a stair step with the before. So there's a before and then an after, kind of a mid-treatment, and then the after photo. And so the after photo, a month prior to the after photo, we incorporated halo. So halo is tricky when you're working with active acne because it can make it worse. You know, any heat, any type of laser that ablates the skin, the heat can induce some breakout.
Absolutely.
And so having your patient on doxycycline a week before and up to a month post-treatment is really helpful with that. But in this instance, you know, we were able to calm down the acne and then address the acne scarring. So yeah, so it was fun. It was, you know, she was so happy through the process, just the little successes along the way. And she's not finished. You know, I'd love to have her continue to come in so that we can help her manage the acne, because that's really the problem, is that it can look great, but then what happens when she gets stressed out or hormonal imbalances. So
we talk a lot about maintenance programs after Forever Clear because we have some really great successful cases. And so then we say, okay, well, let's see you back in 3 months. And it's interesting that the conversation changes, just like you said, adding halo at the end. You know, they go from having active acne and being concerned about that, and we as well have found great success with using the 560 filter, just like we do with vascular lesions, because it does produce that immediate gratification. And even those active cysts will shrink down significantly with that 560 treatment combined with the 590.
Exactly.
We've had great luck with getting all of that just to come down a little bit and increase their confidence in the treatment itself, but also in, you know, kind of going out and facing the world. With Halo, I've taken to using a little bit higher settings. I used to be a little bit more conservative. I would go, you know, maybe 400, 450. Now we're using anywhere between 550 and 700 to really get down in the skin. Even with a Fitzpatrick 4 or 5, I have several Asian skin types that we've used Halo with post-acne. And as long as you pre-treat them with hydroquinone, post-treat them with hydroquinone, you really can get a beautiful result in using those deeper depths at 15 to 20%, and just really watching the skin, cooling the skin, you know, cooling each section after you're finished with it. But Halo has become my go-to for acne scarring when it used to be fractional. And there still is a very, you know, good place for it. And for this patient, I probably would pre-treat those deeper areas either with fractional or TCA cross and then Halo over.
Beautiful. And I think, you know, fractional is still one of my go-tos for acne scarring. And it's just so fast. There's no tip involved.
Right.
You know, you can choose a depth. It's one pulse, so it's easier on them many times. So, you know, that would have definitely been a good option for her as well.
Sure. All right, so my next patient is in her mid-40s, and she is one of those patients that I see in my practice every day. She's in her mid-40s. She has kids that play outdoor sports. She has been, you know, outside all weekend, various weekends for these events, whether it be soccer tournaments, baseball tournaments. You know, this is definitely my demographic of patient. They come in and they say, I just want to look fresher, I want to look brighter, and that was what she wanted. She said, I'm finished with having this dullness to my skin, and that was the word she used, was dullness. She's like, I just want to look more awake. I want things to be a little bit tighter. She mentioned some of the perioral lines, and she said, I don't really want to do filler or Botox. I just, you know, I want something natural. I want something that is going to make me look better. And so we kind of did an evaluation of her overall skin health as well as the products she was using at home, and kind of came up with a plan for her. But what would your plan be for this patient?
So my plan for her would probably be 2 steps. So if one of her main concerns is the laxity that's happening on the jawline and the lines around the mouth. But the first thing that I notice in her skin is just the dullness, the pigment, the colors, and then the texture and some fine lines. And you've probably noticed from this segment already, but I love the BBL Halo combination because it just works beautifully together. They see such change in their skin, and it's change that happens, you know, within a week, and then 30 days later it's even better, and then 90 days later it's even better. And so while we have over 30 lasers, I just really love the BBL Halo combination, and that's what that's why I would start with her. I would start with a BBL Halo combination. And I would use the 515 filter on her. I'm seeing her as a Fitzpatrick 2. And so for a Fitz 2, you know, I would do a full face pass with the 515 filter, and probably around, and again, you know, I would test spot first. So I'm throwing out settings, so of course it always comes with a test spot. You know, probably a 10 to 12 joules, 10 to 15 milliseconds, and 22 to 25 degrees cooling. And I would, you know, do my test spots, adjust, and then get to the higher end of those settings. Do a full pass, go back with the 7mm spot. And for her, I'd probably be closer to 15, 10, 20 for my test spots, and just get anything that I missed. And, you know, I would follow with a Halo treatment. Again, I'm just loving the 400 micron at 30% density. And I don't really dial in a lot of erbium unless there's a real reason, because it adjusts the downtime. And so I would just keep it at 20 microns and then max up to 30% density to max that, or to max the non-ablative wavelength. And then I would put together a treatment of skin tightening treatments for her. I would do a series of, so I would get her through that BBL Halo treatment, have her come back for a follow-up a month later and start a series of skin tight specifically on mid-lower face, and even talk to her about treating around her eyes as well. And I would suggest 6 treatments and do them 7 to 14 days apart. And I spend about 30 to 45 minutes on the face. If it's just mid-lower face, you know, it'd take me probably 30 minutes. If I'm adding in the eyes, it's probably going to be 45 minutes. And then Botox, if she would go for some Botox, that would be great, at least, you know, up in here.
Well, having been a very astute student of yours, Kathy, I as well immediately went to BBL Halo with this patient. When someone like this walks in my office, I get so excited because I know with the tools that I have, I can give her a great result. And this is kind of what I told her. If you can give me a little bit of downtime, I can get you a great result. You're not going to like me today. In a week, we're going to be friends again.
Yeah.
And in 2 months, we're going to be BFFs because you're going to understand kind of what this result really looks like. So that's exactly what we did. Went ahead, scheduled her for BBL Halo. I went ahead and you can't see it in the picture, but she did have some pinkness and broken blood vessels kind of over her malar prominence. So I started with the 560 filter and I thought, you know what, we're just going to go ahead and do that Forever Young pass. And then I focused a little bit with the square adapter on those areas, turning up my energy just a little bit. So I did the pass with her at affluence of 9, pulse width of 20, cooling at 18, because again, she had never done anything. So this was another one of those patients I'm like, go big or go home.
Right.
But let's just
So did you numb
comfortable.
first and then
didn't.
BBL? Okay.
I didn't. So I like doing the BBL first, then numbing. Even if I can do it at the consultation appointment, start them out with that BBL and then, numb and halo later.
Right. Well, especially because sometimes when I put the topical on, if they're red to begin with, it gets worse. And then I don't want a BBL over
And
that.
I really wanted to see where her vascular lesions were, especially, after looking and seeing how much pigment she had. I wanted to make sure we addressed that redness or else it was, going to kind of follow through with her. So we did, with the 560, I did 2 passes at a lower fluence because I find that if I use lower fluences, 8, 9, 10, I'll do multiple passes and still get great results. Or you can get a little bit more aggressive if you know their skin and you know they can tolerate it well. I feel very comfortable going up with her. I didn't know her skin yet.
Right.
So, affluence of 9 was where I was comfortable and I was getting, an erythema reaction on test spotting. So, okay, here we go.
That's good.
Let's do this. So then I went ahead and used the 515 filter with my square adapter, and for her, the settings were fluence of 12, pulse width of 15, and cooling of 15. And I could have gone a little bit higher at the cooling, but again, I was trying to be kind, I was trying to be nice. Then we went ahead and put numbing agent on her. When I got her under halo, I, again, asked about downtime. What do you have going on the next 5 days?
Yeah.
Because if you can give me a little bit of time, I can get you a better treatment. And just like you said with the erbium, I like to go a little bit higher with that. And with her texture issues, I did need to add a little bit of erbium. So my settings for her were 525, 30, and then 40 max
Awesome.
on erbium. And she got a beautiful result. She sent me pictures daily, and she really peeled almost completely on day 3. Between day 3 and 4, she got that full field kind of peeling that, I warn them about, right? You always say, listen, you're gonna feel dry, you might even feel a little bit itchy, moisture that day, Zyrtec if you need it, or an antihistamine if you're getting that itching. We really like to give them a moisturizer that has some colloidal oatmeal in it, for those purposes, because we know with someone like this, it's gonna come up all at once and then it's gonna move off pretty much all at once as well. Day 5, she sent us a picture and she was smiling. So in the other pictures, it was just very kind of plain and serious. And on day 5, she was thrilled with her results.
So what was the product what is your post-care product?
So normally we use the Event SOS kits. Everyone leaves with one of those. I love Sickle Fate.
I do too. Okay.
It's just so soothing, and for a lot of people in the winter it becomes their moisturizer because we live in Ohio. And so we have dry air all the time and it's cold. And so that's one of those products that flies off our shelf because people just fall in love with it. So they have the Avent Spring Water, they have the Sickle Fate. I always put in a couple Theraplex packets for them. If I'm doing fractional, I get a large tub of the Theraplex for them. But just for halo, usually just a couple barrier balms and then the colloidal oatmeal packet, and that gets them through. Really, it's only 5 days, 7 days that you have to worry about. And then we tell them, if you need anything else, you can always get CeraVe over the counter. We give them CeraVe cleanser to go home with. We just like the gentle cleansers while you're healing.
Yeah, keep it
Something
Simple.
gentle. You know, we always tell them, we're going to give you a packet of things to go home with, and if it's not in this bag, don't use it.
Exactly.
You know, you want to use very gentle things. We try to keep them on track, try to keep them compliant, and then once the peeling process is complete and they're starting to see that erythema go down, then we say, then you can jump back into your anti-aging products. And we want them to get on those anti-aging products pretty quickly afterwards because you want to protect your investment. You're investing in your skin and you want to make sure you get long-term results out of that. So we really love the elastin products for our anti-aging, and then we also formulate some of our own products as well. So depending on their skin type and their preferences, whether they like to wear makeup over it, whether they prefer a clean face and just some SPF, so we really kind of take their lifestyle into account when we're coming up with that post-care. If they say, I'm gonna do like 2 things, like I'll be honest with you, I can do 2 things and that's it. Perfect. We're going to pick the best 2 things that we can for them to do and move on with. So, and she's a busy mom. She's got kids to get on the bus, kids to get to school. She needs to leave the house herself. And one of the comments that she made was, I don't really feel like I need makeup anymore.
Isn't
and
that?
I love that
I
comment.
do too. I do too. So
My
did you
favorite
do
thing to
any,
hear.
you didn't do any Botox?
We did no Botox, no filler.
I mean, her eyes look more open. Did you treat
do.
underneath the eyebrow or do anything different on the forehead,
So
or
I
was it the same
treated-
setting, full face?
I treated underneath her eyebrow with the same setting, but what I like to do and what I did with her is I sometimes go back over areas at a lower setting. So for her, I wanted to get that skin tightening. I wanted to get that deep collagen. I wanted to address any blood vessels that she had that were deeper. So 525 was the right setting for me looking at her skin. But then when you see some of that superficial pigment, I turned back and measured the area underneath her eye, and I did 300 at 30%, 30% max. And just several passes to get over there. That way she had the brightening as well. So yes, we want to go deeply with some of these patients, but sometimes I'll go back and do a more shallow setting to make sure that those areas of pigment are getting brighter so that those fine lines around her eyes are getting tighter. I also, with some people that have those deep perioral lines, we'll do a full face treatment, and then just like you mentioned, we'll go back over at, you know, somewhere between 500 and 650 at a high density, and kind of go back over those areas around their mouth, and I turn the erbium up for that.
Definitely. Well, it heals. I mean, it's just this area, it's the area that you can be the most aggressive with.
Right.
And I've really loved how Sciton has switched the software from the Halo to Halo 2.0, where you can shrink the 15 millimeter scan size to 7 or 4, so you can trace wrinkles.
Yes.
And really get close to the vermilion border, so that for those women that the lines are now going, you know, kind of into
Sure.
their lips, you can actually go onto the vermilion border or right above it, and you can see such a nice improvement there as well.
Absolutely. I love the healing process, how it's expedited. You know, when you're using fractional and Halo, or you're using 2 different settings in Halo, it's going to heal faster. You know, the whole face is in a healing process, and I feel like it's just more expedited for them.
Exactly.
Click the subscribe button to ensure that you never miss an episode of LaserChat. In the next episode, Doctors Jason Posner and Patrick Bitter Jr. share their techniques and treatment protocols for addressing common yet challenging age-related skin conditions in 4 patients. Learn how these experts utilize an arsenal of tools, including pulsed light, full field and fractional laser resurfacing, injectable neurotoxins and fillers, and topicals to address severe sun damage, flat and raised benign lesions, banding and laxity on the neck, deep perioral wrinkles, and melasma and hyperpigmentation in ethnic skin types.